Welcome. Today we're talking about the very popular notion of being able to heal your health through your gut. So we set up the Gut Health Centre here with Naturopathic Doctor Sara Jefferson in order to really help people with digestive disorders, bloating, irritable bowel syndrome, Candida overgrowth, leaky gut syndrome, and the usual tiredness and fatigue that a lot of people seem to suffer from. So I'm going to introduce you to Sara, who is not only a very experienced naturopathic doctor from Australia, she has a degree in biochemistry and she's worked at some of the top cancer institutes in both Australia and the US. So she's more than qualified to help us with this and all these amazing modern tests that we can do nowadays. So please tell us about a patient that you've had some really great success with, Sara.
The person that comes to mind is Christine. She's a 31-year-old investment banker, had a couple of years up in China, in Shanghai, and when she came down to Hong Kong, she decided to get a couple of symptoms that she'd had for a long time, actually since she was studying in the US. Sorted. So she'd gone to a gastroenterologist who had had a colonoscopy and had a look and gave her the all clear. There was nothing wrong with her, but she still had bloating, intermittent diarrhea, brain fog, which was beginning to affect her career, and her hormones were a bit crazy. So when she came to us, we did some testing. We did a DNA test of her stool, which gives us quite an accurate picture of the bacteria in her gut and also gives us some interesting insights into gut chemistry.
So what was going on in her gut?
She had an imbalance of bacteria, including a few nasty ones and a couple of parasites. And
how do you treat that then?
well, it's quite a long process, but initially we treated her with some herbal antimicrobials, which we tailor-made for her and her combination of bacteria from what we knew from her testing.
Well, this is what I've noticed. It's very common for everyone to get the same thing, like grapefruit seed extract, and it's like, surely that can't work for everything. So I'm glad to say that you match infection to herbs and you actually know what works for what.
Yeah, the research is really showing some specificities, which is exciting for us because it's always great to be more specific and make tailor-made plans for each patient, which is really an exciting development in what we do.
Fabulous.
Yeah.
And did she get better quickly or a few months?
Well, she showed vast improvement quickly. It is a program because when you have parasites like that, you often get intestinal permeability. The common name is leaky gut. And that takes longer to heal. Like you would imagine a wound takes some time to heal. It takes even longer in the gut. But the good news is that she had, within 2 weeks, her aches and pains had gone and she'd felt her sharpness come back. And that had a lot to do with the antimicrobials. But I also feel that we talked quite a lot about diet and the dietary change helped.
Thanks very much, Sara. So medicine's certainly changed since the days that when I graduated. We've got DNA tests and we've got small intestinal bacterial overgrowth, that's SIBO tests. We've got urine tests for environmental pollutants and heavy metals like mercury, lead and arsenic and cadmium. So there's much more we can do than the old-fashioned blood test for patients now, and I really believe that's a good thing. If we can help you in any way, please make an appointment.